name is Craig Villari. I am an ear, nose, and throat doctor here with Bellevue ENT. I moved here in April of 2019 after living in Atlanta off and on for about 20 years. I did my residency in Atlanta and then went ahead and did a special year of training at UCSF, University of California in San Francisco, where I focused on treating patients with voice, airway, and swallowing concerns. So we moved out here with our family back in April and very excited to be out here and taking care of folks in the Pacific Northwest. I see all aspects of ENT concerns in patients of all ages. I do have a special interest in laryngology, however, and I think I'm drawn to that because it affords me the ability to improve patients' quality of life so dramatically. Whether it be that I'm helping someone be able to talk more clearly or swallow more easily or even breathe more easily. All of those things really help us feel human, and I get great excitement and great kind of personal gratification from being able to help patients do that. I really pride myself on connecting with patients and communicating with them to figure out what's important to them. The first part of our clinic visit is really going to be spent in conversation, talking about those things, and also trying to figure out, are there any patterns, are there any little bits of information that we can gather that'll help narrow the diagnosis for us. From there, we'll shift to going ahead and doing a head and neck exam. That means that we'll be checking the ears, the nose, the mouth, the throat. And depending on why a patient's coming in, we may end up doing some extra examinations for dizzy concerns, sinus problems, or throat concerns. Some of that may entail using a small camera and taking a look in the nose or the throat. And that's usually a really well tolerated procedure. Once we've got all that diagnostic workup done, then we're going to be talking about developing a care plan that's appropriate for the patient. This is absolutely a two-way street, and I like the patient to be involved, and I want them to ask a ton of questions about what's going on so that we can both be on the same page and that we can both feel confident moving forward with further diagnostic or treatment workup. Proliance surgeons is a terrific multi-specialty group of surgeons. One of the things that I really value about Proliance is that if I don't have a colleague here within Bellevue ENT that can help a patient, I know I'm going to be able to find a resource that's going to be able to help patients get better within Proliance itself. I think a great surgeon needs to be technically excellent, but also needs to be humble. They have to be able to interact with patients to be able to figure out what's important to the patient and what their goals are for surgery. You use that information to build a surgical care plan, and I think that helps put the surgeon and the patient at ease that we all are on the same page moving forward. At that point, the patient really has to let the surgeon do their job, and that comes from experience and from training. And I think that's something that we all here at Bellevue ENT really kind of push forward and are able to offer our patients.